Hello and welcome to the NTI PodTalk. My name is Dianne Koehler and I'm Director of Nutrition Therapy Institute. Join me as I talk to interesting people in the field of health and wellness, food and farming, and anywhere else we find conversations that matter to our community. By listening, you'll learn a little about NTI and a lot about the things and people around you that make a difference for your wellness. Welcome and let's get started. Hello there. Welcome back to another edition of the NTI Pod Talk. This is Dianne Koehler, Director of Nutrition Therapy Institute, and I am so pleased to be having a wonderful, like-minded person on the webinar, Jenny Breen. And Jenny was introduced to me through someone who our community may already know. She's one of our chef instructors, Jackie Gable. Jenny does so many amazing things in the world of culinary education and nutrition education. And that is why I'm so excited to have this conversation. So, Jenny, welcome. Thank you so much for being here. I am really looking forward to this conversation.
Thank you. Thanks for having me. I am also looking forward to it. I love meeting and talking to folks who share similar values. And I would say, you're doing amazing work too. So I'm
Thank you.
excited to talk. Yeah.
Thank you. All right. Well, let's start off by talking about something that is, I think, so critically important. And I, based on what I know about you and your background and the work that you do, I think you would agree. And that is that there is almost an offensive dearth of nutrition and culinary education in medical training. Medical doctors don't get enough training in nutrition. They really have very little knowledge about nutrition. And I always find it interesting that when people are making recommendations about, dietary things, they always have this little caveat that says, but don't make any dietary changes without talking to your doctor. And yet, it's pretty clear that
Right.
doctors don't really know about nutrition and
Right.
dietary changes. So by way of that sort of brief introduction about an alignment that you and I have, can you talk about what you do and what your interaction in training medical students and medical professionals is?
Yeah, thank you. That is really funny. I thought you were going to say dietitian, but you're right. People say talk to your doctor, and um, it is ironic in
Yes.
so many ways. There are so many ironies in the way that we do healthcare anyway, right?
Yes.
Not the least of which is that probably 80% of what doctors are treating, or I would say responding to, are diet and lifestyle related chronic conditions that could literally be prevented or at least managed or even reversed with diet and lifestyle modifications, right?
Mhm.
And yet, this is not something that is really prioritized in
Mhm.
medical education, or really, I'd say health professional education at all, unless you're studying to be a dietitian. And then there's a whole other conversation about what that looks like.
Right.
Um, so I have a very unusual sort of path of my own to have arrived in this role. I am not a dietitian and I'm not a doctor. My background first is as a chef for many years in our local food scene here in Minneapolis, and I was very engaged in local food producers and production and agriculture, and so really started from a place of recognizing that we are within a food system and that it's not enough just to choose healthy food, but I think it's really important to know more about where your food comes from and how it's produced. And all the stories that go into that, whether it's how the land is treated, how the labor is treated, how, how people are raising and distributing and processing whatever food it is that's eventually arriving on your plate. So I really, that was how I got into chefing, really, was to feel like I could be a conduit, I guess, of some of that. And I also really loved cooking and had my own personal journey with eating and food and nutrition. But what I learned in that process as I had a restaurant in the 90s and was really doing outreach to promote the restaurant and discover that people really had a disconnect and that they didn't know um, why that mattered, why knowing those things mattered. And they also knew that they should, quote unquote, eat, quote unquote, healthy,
Yep.
but what that looked like and how to translate that from
Mhm.
getting ingredients to feeding yourself was pretty confusing for folks. So I started just wanting to do public health and education in the sort of community space. And when I went to get my master's in public health nutrition, and when it was twice the age of most of my classmates and had two kids and was probably older than most of my professors, I didn't even hear them talking about this stuff. And I was kind of like, okay, fine, like behavior change is fine, but what about food systems and what about sustainability and what about prevention? I mean, public health is about prevention, but anyway, I felt like I was on my own journey and I just had an opportunity to, do some research and learn more um, about academia and to use that to my, sort of incorporated into my big pivot to get into health and education rather than the food business. Um, and then it was just this fascinating organic process of me being a chef who also knew about health and nutrition. And suddenly people were kind of like, oh, well, we would love to learn more from you. And I started teaching in food science and nutrition again, it's kind of sideways through an institute called the Healthy Foods, Healthy Lives Institute that was kind of trying to combine agriculture and nutrition and food policy. And started working in food science and nutrition, which again was another one of those like, oh my gosh, here we are literally in the College of Food and Agriculture. And nobody's really talking about the relationship between food production and human health, you know?
Mhm.
So it
Mhm.
was like each time I got into another space that seemed to be about health and nutrition, um, there were all these shocking sort of gaps or disconnects. So I just, with like-minded colleagues, created a class that included all of that. And I mentioned to you that so I've taught that class for 11 years and just recently phased out, in part because it never fully integrated into that department. The department has always had a little bit of resistance. I never really felt totally welcome. I think people were a little uncomfortable or threatened by some of the things that I was teaching about, co-teaching. I co-taught that class. And so it was always an awkward kind of place to be. But during that time, I got connected with an integrative doctor who had just gotten actually she was in the process of becoming finishing a fellowship in integrative medicine and had just been kind of introduced to this concept of culinary medicine or um, food as medicine. And somebody said, oh, you should meet Jenny's been trying to figure this out for years. And so we were introduced and we dreamt up a pilot class that we found a tiny grant to fund, and it was for medical students. And we held it in an agricultural food hub that had also just been built in Minneapolis or St. Paul. Because I said, look, if we're really going to teach this stuff, this is where it should be. It had a teaching kitchen in it, but it was also a place where local, small immigrant farmers brought their food and it was aggregated and distributed, and they were supporting sustainable agriculture. And I said, look, they might as well see like the whole picture.
Mhm.
And so we offered it. The medical school, this was in 2016, looked at us and said, Why would we teach medical students about this? Like,
Yeah.
sure, if you want to, go ahead. I mean, you can do it if you want. We're not going to get involved." So we offered it independently as an elective, for no credit. We had 60 some medical students apply, even though they weren't getting any credit for it. So it was obviously interesting to them.
Mhm.
And we didn't, I think we chose like 18 students. It was amazing. We learned a lot. It was totally, we kind of made it up as we went along. My doctor colleague had never taught cooking before. I had never worked with medical students before. So it was a really incredible learning experience. And although the medical school didn't really get it, the Bakken Center for Spirituality and Healing, which is a part of the academic health center at the university, and has a health coaching and a doctor of nursing practice and an integrative medicine um, programs, said we would host that class here. That makes a lot of sense to us.
Mm.
Um, However, we'd like to offer it to all health professionals. And so it became an interprofessional graduate course. And we've been teaching it ever since. And recently we were able to add a continuing medical education version. So we have continuing education credits for doctors and nurses and pretty much all health professionals, dietitians, pharmacists, mental health professionals can get credits. And that's been just for the last few years and has also been really growing and I think deepening as we really hone in on the things that we see being really important and resonating. And both of those classes involve a cooking component and a didactic component. And then during that time, we also became connected to this national, actually, it was just becoming a national network called the Teaching Kitchen Collaborative. The founder of the Center for Spirituality and Healing has been in integrative medicine for many years, and she was connected to this man, David Eisenberg, who is a doctor at Harvard, who had been hosting a conference called Healthy Kitchens, Healthy Lives, in which he brought health professionals to the Culinary Institute and taught them how to cook and felt very, very strongly that it mattered. And he, after doing that for a few years, decided to start what he called the Teaching Kitchen Collaborative. And he brought together at that time 20 some academic or healthcare organizations and said, okay, we all share this vision. What can we do together? And that was also about 9 years ago. And from that, that organization has grown significantly in terms of members and in terms of they've hosted a couple research conferences that have been pretty significant this year. They'll be hosting their first public-facing symposium in November. And it continues to be an incredible resource and just a place where there are more like-minded folks. We don't all see things exactly the same way. We don't all do things exactly the same way, but we all share this real deep and strong recognition and understanding that culinary skills have everything to do with healthcare. And so it's been a really amazing journey. And thankfully, in the last couple of years, our medical school is going through a big change, which I wouldn't say is a good thing in a lot of ways, but in that process, our colleague who oversees what's called the life stages thread. So you have courses and then you have some different threads. You have a public health thread, you have a life stages thread, which, as you can imagine, includes, they call it sex, death, and food. But food is a part of it, obviously, because it's relevant to every stage in life, but there was never any actual curriculum about it. So we got brought in during this major curriculum transition to build curriculum in the medical school. And we are now essentially, I would say, creating content for every single course, from GI to clinical skills to, endocrine and reproductive studies. So that's been extraordinary and fascinating and also really, really hard.
Hmm. Hmm.
So,
Wow. So, you're talking about a 9-year history of being involved in this, and um, that is that is a long time that you have had this impact in this type of education. But um, I certainly have never heard anything like this, and I have never heard of medical schools ever being interested in teaching nutrition. So, um, you know, is this an outlier? Is this, what do they call it, a unicorn?
and
Where
we
there's
use that
no
language a
no
lot,
other
actually.
no other medical programs do something like this, or
No, no, it's actually surprising. And this is why I think the Teaching Kitchen Collaborative in my mind is sort of at a tipping point right now. And they hosted a research conference, I think it was 2 years ago at UCLA, which has an incredible culinary. I don't, the language is hard. Is it culinary nutrition? Is it culinary medicine? Is it food as medicine? I
Mhm.
like the word or the term culinary nutrition
Mhm.
because I think that makes more sense. I think culinary medicine gets fuzzy, and I have a lot of medical students saying, just tell me which foods are for which conditions. And I'm
Right.
like, it's not really how it
Not
works.
like
So,
that.
so I like culinary nutrition because I think that's really what it is. But at this research conference, there were presentations. I mean, they took submissions for presentations from probably hundreds of organizations that have some version of culinary medicine, whether it is doctors who are just partnering with dietitians and trying stuff, or whether they're actually teaching a course to medical students, or it might be a teaching kitchen that serves patients in hospitals. So there are, I would say, dozens, not probably hundreds yet, but certainly many dozens of programs around the country and actually around the world. There's numerous Canadian participants in the collaborative. There's folks who are in some Asian countries. So um, there are, oh, Germany, there were a couple really interesting presentations from Germany. So it's out there, but I agree, most people have no idea that this is out there, or even, I mean, I think medical students, some anyway, are going to start looking for programs that have these offerings because they are starting to realize this is super important. Now, I also want to say, and I feel like I have dietitian friends and colleagues, or even just people I follow, who are a little defensive about this because they think what we're saying is, oh, doctors can do what dietitians do, and that's not really the point at all. I think medicine is a collaborative effort. I think that most of the time it takes a team of people with different expertise. But I do think you can give doctors and nurses and other healthcare professionals a lot more tools to engage their patients upstream and to give their patients practical things they can go home with to deal with their either current or potential diseases, and to engage in the broader community around things like making sure people have access to good, nutritious food and resources for nutrition education. Because doctors, for better or worse, have a platform that most of us don't.
Yeah. Yeah. Um, so many things came into my head while you were talking about all that. First of all, I think it's great that this is becoming, a little bit more popular.
Mhm.
Um, I was so uh happy and inspired to hear a medical doctor. He is a surgeon who works with pancreatic diseases. And I'm trying to remember the things he does, but Dr. Marty McCary, he just wrote a book called Blind Spots, something about what the medical
Mm-hmm.
industry got wrong or something like that. I forget the subtitle, but Blind Spots is the main title of the book. And what I've been hearing him say, all you know, all of his podcast things that he's doing, um, he talks about the fact that medical students really don't know anything about nutrition. They're not being trained to help their patients understand about how their diet and lifestyle is a contributor to chronic disease, and chronic disease is you can prevent chronic disease from happening if you take notice early and start making changes. And the one thing he says over and over again is, wouldn't it be nice if we treated diabetes with cooking classes rather
Mm-hmm.
than with Ozempic?
Yeah.
And whenever he says that, I hear him say, I'm like cheering. I'm like, yes, yes, because, you know, at NTI, we have a cooking program and we teach people how to be chefs. And so it's completely like validating and vindicating things that I've been saying for years. And I thought that I was, in a vacuum, and I'm like, screaming things into this big black hole that nobody's paying attention to. And come to find out, I didn't know anything about you. You've been doing this for 9 years, and that's amazing. So congratulations in being
Yeah.
on the forefront of this movement in getting into uh, teaching medical students about nutrition and cooking. Like, I
Mm-hmm.
completely agree with what you said. It is, I go out on a limb and I say it is impossible for someone to find health and maintain health if they don't cook for themselves, if they don't know how to cook for themselves. I just think it's impossible, because you cannot exist in this world where everyone's eating poor quality restaurant food, whether it's, you know, fast food restaurants or even higher end restaurants. In many cases, they use poor quality ingredients. People are buying food at convenience stores and, all this kind of stuff. They're not cooking for themselves. And I don't think it's possible to, certainly not overcome health challenges. So to find health and then maintain health without cooking for yourself. So
Yeah, I mean, I think you're right. And I also think, I mean, one of the things that has been really important to us as educators is the just building confidence, because I think that's the other thing that I think a lot of people misunderstand about what kind of culinary medicine is for, or what the intention is. And it's not, again, to make doctors suddenly, you know, be nutritionists, but it
mhm,
is, number one, you have doctors who they themselves may or may not practice self-care in a particularly effective way. And we know that the culture of healthcare and medical education is not a particularly healthy one, sadly. I mean, when you think about what food, when, they have lunch and learns where you're supposed to eat pizza and learn whatever it is that your lecture is, or, work in hospitals. For most hospitals, including the one I work in, have questionable quality of food. So
yep,
we don't, so they themselves have to sort of build the skills
mhm,
if they don't already have them, and many don't,
mhm, mhm,
um, so that they also can have the confidence to help their patients build those skills.
mhm,
That's one thing. And the other thing is that because I come from a sort of community space and public health space, there's still a really big disparity between what people have access to and what they need, right, to be healthy. So I absolutely think everybody needs to know how to feed themselves and cook for themselves. And I think we have to really, really tackle this system that makes that inaccessible for a lot of people. And again, I would say not because we can't do it, but because it's not everybody's priority. There's a
Yeah.
lot of people who are benefiting greatly from producing really, really low quality, cheap food that is contributing to a lot of the health problems that we see, right? And so it's for me, it's a both and. It's like, yes, everyone should know how to cook and feed themselves and shop and all of that. And we should be holding the food industry accountable or doing our best to really take that apart so that um, access to food isn't a barrier for people being healthy, you know? So it's for me, it's kind of that conversation too. And I do think that's another, and that's one of the things that we include in our curriculum with medical students is this concept of the food system and inequity and why, you know, how you can talk to a patient who has health conditions that are diet and lifestyle related and say it's not your fault. Like you're a victim of a really messed up system, which makes it
Yep.
really hard for you to be healthy,
Yep.
right?
Yep.
And take that shame and blame out of the conversation and say, look, let's navigate what we can, knowing what we do, and here are skills to do that, because that's a skill too.
Yeah. Yeah, no, I totally agree with that. And I also agree that, the effort or the work is not to turn medical doctors into, people who solely work in the field of giving nutrition advice, because certainly they have their own specialty that is required and needed, and their own knowledge base that's required and needed. But I do think it is really helpful for them to at least understand the influence of diet, as you said, both on themselves, also on their patients, so that it creates more of an awareness, and someone goes to a doctor and their doctor's like, yeah, so before we start down the
Right.
path of drugs
Right.
and, you know, all this invasive stuff, I'm going to hook you up with I'm going to use the term nutrition therapist because that's what
Right.
our graduates are. I'm going to hook you up with a nutrition therapist who can really help you dial in your diet and things to think about your diet. And then let's come back and we'll talk about where we go from there.
Right.
But so, that's
Absolutely. And honestly, like even just two or three questions, right?
Mhm.
What does a day of eating look like for you? Like,
Right.
how many times is a doctor even asked that or taught to ask that question? You know, I mean, we literally teach a session in which we say, how do you ask somebody about how they eat?
Yes.
Because no one has talked about that before. And they, you know, and they have to sort of understand like it's a sensitive issue. You can't just say, oh, this is good, this is bad, or you weigh too much, there's a problem. Like there's so much nuance there. And I think that is part of what talking about or knowing about food is recognizing that it's very specific to every person and it is totally relevant to their healthcare, right? Like it's totally relevant, even if they have an infectious disease, right? Which is not necessarily caused by diet, but there's all kinds of things that can be beneficial in terms of how you respond to those things.
Yes, your diet definitely influences your immune system function. So, yeah.
Absolutely. And you know what it I mean, it's fascinating, right? Because like you said, I've been diving into this and now and continue to dive more deeply. I mean, now I'm really, really diving into the mental health gut stuff, which is super, super fascinating and so important. But kind of what it all boils down to is inflammation, right?
Yeah,
And
right, exactly.
and everything like food and the gut are entirely r- related to inflammation. And so, like all of the things, they're all inflammatory conditions, even
Mhm.
mental health conditions.
Yep.
So
Mhm.
it's pretty fascinating. And I also just think it's hard, especially for doctors, but for a lot of people in healthcare because it's so nuanced. It's not very black and white.
Yeah. Yeah, there's not, as you were saying, there's not this food addresses this problem.
Right.
It's not like what do they say? A pill for every ill, right?
Right.
So you don't have a drug that addresses a particular symptom, or you have a drug that addresses a particular symptom, but you don't have that in food
Right.
and
Right.
nutrition, you
And
know?
there's a lot, but what's kind of nice on the flip side is there's a lot of universals, right? Like, so eating this way is good for all the things, right? So
Yes,
it's not like you
exactly.
have to say, okay, well, if you have this, then this, there's certainly
Right.
specific things, especially if it's a digestive or gut related thing. But for the most part, like whole foods, quality fats, like that's good for all the things, right?
Right.
And
Exactly.
so it in some ways, it makes it a little it's a bit of a relief, I think, or sometimes we call it the punchline, like we say, "Give us a rationale." Like, we usually have our students, we give them a case, and then they have to come up with a recipe and do a demonstration and stuff, and they have to give a rationale for why they chose the recipe they did, and some of it has to do with the patient's, situation. But it's always kind of funny to us because it's like, any of these recipes and menus would work for any of the cases, really, right?
Yeah.
So,
Yeah, absolutely. Um, and you're talking about gut health and um I am still to this day shocked and surprised when I hear people say, you know, specifically talking about gut health, when I hear people who have some sort of really dramatic gut, disease like colitis or Crohn's disease or those are the ones where it is like most egregious, where they go to their doctor, you know, and they say, "Well, should I think about what to eat?" And the doctor says, "Ah,
no, has
your
nothing to
your
do with
your
diet.
diet has nothing to do with your gut health." And I'm just like pounding my hands on my head like,
Mhm.
"What?"
Right? I
This
know.
comes up so often with my clients, and, I've heard students say that about interactions with family members and their doctors, and it's just like,
Mhm.
how can that be the prevailing wisdom that is coming out of gastroenterologists' mouths, that what you eat has nothing to do with your gut health? I mean,
Yeah,
you could make a case what you eat has nothing to do with, your joints. I mean,
you could,
I
but really you
think it
can't, right?
does.
Oh, it
I think it
totally.
does, but, someone could say that and you'd be like, "Yeah, that probably makes sense. What you eat doesn't have anything to," but what you eat doesn't have anything to do with your gut health? Like, that's the
Right.
most,
No, I know.
um,
I know.
intimate interaction with your
Uh-huh.
food is your gut. So it's just
Yeah.
it's crazy.
My colleague, Dr. Shafto, the integrative doc who I've been teaching with and creating content with for so long, we have this conversation all the time. And she was practicing in integrative pain management. So she was doing non-pharmacological pain care, right? And so she had people all the time who were told this, right? And they were like, I just feel like that can't be right. You know, I just feel like maybe there is something I can do with
Yeah.
my diet, and she would be the first person who would navigate that with them in many cases. Or people would come in with all kinds of things and never have been asked about their ever.
Mhm.
And she would just be like, like the kinds of conditions where, serious, serious digestive issues or skin issues or pain. Yeah, and so, I mean, I think some of that is that training, right? You get the training and then you're not going to veer from that because you don't know anything else, right? You don't have the confidence or enough experience to talk about that stuff with people. And you know that the medicine is working, right? In the sense that it's, I don't know, I guess it's stopping the leaky gut. I don't know if it actually really does do that, but
Symptom, yeah.
right? The symptom, it's not preventing it, it's just stopping you from feeling the way that you were feeling, right? And so for them, it's like, okay, the medicine's working, so I don't have to deal with that other stuff.
Mhm.
Um, And it's funny when we do this lesson with the students where we say, when would you kind of ask patients about food? And they're like, oh, if they're having stomach pain or, this or that. And I'm like, when wouldn't you
Right.
ask a patient about food? When do you think food is not relevant? And they all kind of sit there like, it's like, okay, if they come in because they just literally had a terrible accident and they need it, that's one thing. But
Sure.
kind of aside from that, there's really no time where it doesn't make sense to bring that question in and to explore that.
Mhm.
So it is really interesting. It's there's a lot of navigating to do, right? Because you've got I don't think in the end, I do believe that most doctors, maybe all of them, really want to help people, right? They want to do something that makes people feel better or fixes things, right? I really believe that. Um, but I think that there are competing interests and competing influences on health systems for sure.
Mhm.
And certainly the food industry is very powerful, even powerful enough to influence a lot of our government's policies around food and nutrition.
Yep.
So I think, it's kind of hard to untangle all of that.
Mhm. Yeah. Um, yeah, I totally agree with you. And I think that uh so many people don't understand how those influences in the public dissemination of health advice and nutrition advice um, are really corrupted by the agencies and organizations and companies, privately owned companies that are having an influence on that information. And so much of that information is geared towards just making more money for those people. And it is really a corrupt system. And I just think people either, well, they don't know about it. And sometimes they don't want to know about it because then it makes them question a lot of things, right? About,
Yeah, I think so. And I've been really lucky, I think, with the way that we're building this curriculum in the medical school, because I'm like, look, we got to talk about this. So
so
we
awesome.
talk about government subsidies and we talk about, we look at the dietary guidelines and you look at what our government subsidizes, and it's like, how are we even supposed to eat
Right,
half our meals be fruits and vegetables when we subsidize 3% of what we support from the government is the production of fruits and vegetables? Like, that doesn't
right.
even, it's not even
Yeah,
possible,
yeah.
or when, like, dairy is on the dietary guidelines and I'm like, y'all, dairy is not a food group. Like, it's a protein, it's a fat, it's a carbohydrate, sure. Why is that glass of milk there? you know
Hmm.
Huh. So it's I mean, I'm lucky, and I think that's one of the reasons that it was kind of sensitive in food science and nutrition, because we are a land grant university and there was a lot of USDA support for the College of Food and Ag. There was a lot of conventional agriculture and conventional agriculture research happening there. And I think to sort of push back on that or to shine a light on some of these questions made um, certainly some other professors or some of the people in the department uncomfortable, you
Hmm.
know,
Yeah.
because I don't think people really realize the way that it works,
Hmm.
between our government and food production, and then what kind of food is available to people to eat, what they
Hmm.
can afford, and then what happens to their health. And then our healthcare system is super overburdened. And yeah,
Yeah, it is definitely a whole big thing.
yeah,
And there are so many tentacles that have themselves wrapped around so many of these things that, it is hard to do. But I think that, certainly you and, you know, what we're doing here
Absolutely.
to work, on the individual level for us, our students are not generally in the medical field, although we do have a growing number of nurses who
Mhm.
are taking our program, both our nutrition program as well as our chef training program, because they see what's happening, um, and everybody sees what's happening, but for whatever reason, nurses have, because they
Yeah.
have much more interaction with patients, they actually get it, and they get frustrated with the sort of normalized poor health of patients, and then they
Mhm.
see what the hospital is feeding them, and they see what, you know what if they are given any recommendations, they see what the recommendations are about food, and these nurses are just getting really frustrated because maybe even more so than, I'm not going to say more so, but just as much as doctors, people go into nursing because they truly care about helping patients, and they are right
Yeah.
on the front lines.
They are on the front lines, and they're the ones, you're right, they're the ones who really are spending time with patients, um, in the hospital and overtime and kind of doing that sort of management of
Hmm.
conditions that doctors aren't doing
Hmm.
necessarily.
Hmm.
Um, yeah, I mean, I think that's wonderful. And that's kind of what's happening for us too. Like with our CME class, we always ask people why they are there or how they found us. And they often are like, look, I've been doing this for a while and I know that food and diet are really important and I just need to know more about it. Like I didn't get this in my training. And often I think again, it's a little bit trending right now. Like food as medicine is a term you
Hmm.
hear, which you didn't
Hmm.
used to hear. I
Hmm.
don't love that term, partly because of kind of what we were talking about, where I feel like people think of medicine as like the fix, right?
Right.
And so
Right.
sometimes I'm like, yeah, I mean, I'd rather talk about food as prevention or
Yes.
food as health or food as
Yeah.
nourishment,
Yeah.
because I feel like even just connecting it to the what we think of as medicine makes I feel like it's a little different, but it is out there, and so it's an opportunity to sort of have the conversation with people who may not have thought about it before that. um, I do think that it would be really cool if you could find a way to engage with the Teaching Kitchen Collaborative, because I think a lot of people would love to know about what you're doing and that
Hmm.
you've been doing it for so long. I mean, I've told this to Jackie before, but when I was trying to decide, am I going to do a nutrition program? Am I going to do a public health program? I looked at NTI. I
Hmm.
just couldn't, I was in Minneapolis with kids and I just
Hmm.
was like, oh, that looks like a pretty amazing combination of things, right? Because I knew like the cooking and the nutrition, it just made sense together.
Hmm.
So I think people just like you haven't known about some of this work. I'm sure
Yeah.
people know about you and would be like, oh my gosh,
Yeah.
that's exactly the kind of stuff that we are trying to do.
Right. Yeah. Well, yeah, I hope um to get more exposure in
Yeah.
those ways as well. So we're definitely thinking about that. But um what one last thing that I wanted to bring up, because I want to be conscious of and of your time and my time as well. But one more thing that I want to bring up that you and I briefly talked about uh before when we talked, and I'm gonna have to read the name of this. So um in April of this year, April 2024, an editorial was published in Advances in Nutrition.
Mhm.
Um, and it is titled Prioritizing Nutrition in Medical Education. The Time Has Come. And it is written about the need to almost uh, through enforceable means, force medical education programs to include some sort of nutrition training, because, this paper talks about how medical doctors, it says medical schools still fail to include the recommended minimum of 25 hours of nutrition training in their undergraduate medical education programs. That 25 hours, it is like a dream, because from what I have heard of medical doctors, they're like, yeah, I got 2 hours, or
Yeah.
I got 3 hours, or I didn't get anything. So,
Well,
this is amazing.
right. And what they do get is micronutrient science, right? So
Yes,
they don't learn anything about food.
right.
That's
Yes, you're
that
right.
is not what they're learning. They're learning, that these vitamins or these vitamin deficiencies or these micronutrients. Honestly, that first class we did with medical students, when we asked about nutrients or, micronutrients or minerals, they could answer that question. And we'd say, okay, where do you find those in food? And they
Yeah.
were like,
I don't know.
I don't know. So even whatever they're getting isn't that.
Yes.
But yes, I agree. I think it's exciting. I think that at a minimum it should be 25 hours, and it shouldn't be, and that's not the stuff they're already getting. It should be
Mhm.
25 hours of applied nutrition or
Mhm.
food related content.
Yes.
Because I also feel like we get into this thing of nutrition science, which is what my food science and nutrition department thinks my students need more of, and they need less of the culinary nutrition. And I'm thinking, I think they need to know how to translate that to food and people. And
Mhm.
that's what they're not getting.
Mhm.
And it's interesting that we have, yeah, so advances in nutrition, that article also, my colleague, my doctor colleague and I published a paper last year that was in a collection in the publication Nutrients.
Mhm.
And it was, I think there were 29, David Eisenberg guest edited. And so he reached out to all the Teaching Kitchen folks. And I think there were about 27 or 29 articles published that were about something related to culinary education and healthcare. And it's pretty powerful stuff. And it is everything from, we talk a little bit more, we talk about medical students having confidence, and we've been measuring this now for 8 years. And so we have a decent amount of data that shows that students finish the course feeling more confident, both about their own self-care and about how to talk to patients about these things. So awesome, but also
Right.
everything from, various research trials to working with patients. But, I would say there's a critical mass now, or a tipping point, like I said, of data and sort of real life examples showing that this stuff matters.
Mhm. Yeah. Um, I totally agree. And it's so, I'll use what I said earlier, validating and vindicating, because I've been talking about this stuff for 25 years.
Yeah, you were way ahead of your time,
Yeah.
actually.
So, I, it's like, yes, and I'm just jumping up and down every time I hear something new. Um, and so what I didn't say is that paper that I just referenced, um, is kind of the, I don't know, representation, or the exhibit of something you told me about, which is discussed in this paper, which is this uh, resolution in the U.S. House of Representatives that was introduced by James McGovern and Michael Burgess. James McGovern from MA, that's Massachusetts.
Massachusetts,
I don't
yeah.
know, yeah. And then Michael Burgess is from Texas, and this is something that is actually being introduced in the government to saying calling for meaningful nutrition education in medical schools, residency and fellowship programs, and other health professional programs. Um, and what is not discussed in this paper is what you told me is that that resolution actually ties, if it passes, and if this portion stays, as it moves through, um, whatever steps it has to go through, um, to become whatever official statement it's going to be, that it actually ties federal funding to medical
Mm.
schools,
Yeah.
to them actually implementing this in their programs. And
Mhm.
I think, while I don't like inherently the concept of forcing people to do something by holding the money
Mhm.
hostage, I think that's the only way that this is going to be implemented. And there should be some, federal funding is taxpayer funding. All
Mhm.
of us are taxpayers, including all the people who have chronic illnesses.
Right.
And I think it is important that the government is telling medical schools that there needs to be a little bit more skin in the game for them
Yeah.
to understand the influence of nutrition on their chronic illnesses.
Yes.
And
Yeah.
yeah, so I'm completely happy about this. So,
Yeah, and I think it'll be interesting to see, of course, the outcome of this next election may
yes,
influence how this how this goes.
right.
But it will be interesting to see then, if this passes and becomes law, and then how is it enforced and what are the standards and does there become then this challenge of figuring out what it means and what is
Yeah.
the measure and all of that, which I think is an important conversation, right? And I know, like, even just the White House Conference on Hunger, Food, and Nutrition that happened last year, that was the first in 50 years,
Mhm.
was they had a whole section of that conference on what they called food as medicine. And so, even at that level, and, again, I don't know if people realize the Biden administration had that kind of focus, but it's out there and people are recognizing that these things are interrelated. And so hopefully, it continues in that direction. But
Mhm.
yeah. But
Yeah.
like you, obviously there are some people who have understood this for a very long time, but it's really hard to navigate and change the system.
Mhm. Yeah. Yeah. So that's why we do what we do on an
Yeah.
individual level, teaching people, helping
Yeah.
them understand, so that, you know, what I always say is that with us here at NTI, one of our core values is making a difference. And so
Yeah.
we want to make a difference first in the lives of our students. And then as they go out and start having an influence on those that they interact with, together, all of us
Mhm.
in this community, and I'll add your community to my community,
Yep. Yep.
we're all going out, and by being more vocal about this, and the importance of this, we all are going to help propel this newly sort of sparked interest in this, and hopefully fan the flame, not in a negative way, but fan the flame so that it
Mhm.
continues to grow and it just becomes common knowledge.
And then we start preventing, what I say to the doctor students jokingly, but not really, is, honestly, my goal is to put you out of business. Like, I really don't want these people ending up in your clinic because of something that was preventable.
Right. Yeah.
So that would be my hope, right? Is that this health of people looks really different and healthcare looks really different then.
Yeah, absolutely.
Yeah.
Well, this has been such a fun conversation. I'm so glad that we were connected with one another,
Yeah.
and hopefully we can continue to uh, keep in touch at least, and maybe find future areas of collaboration. So
Absolutely. I
Yeah.
love what you've been doing, and I think I do want more people to know about it, and I think that, yeah, I think there's definitely opportunities for us to find ways to collaborate. So
Yeah, absolutely.
thanks so much.
All right. Well, thank you, Jenny, and have a
Yeah.
great rest of your day.
Yeah, you too. Take
All
care.
right. Thanks.
Bye.
Hi, Dianne Koehler here again. If you found this conversation interesting and haven't already become a student at NTI, check us out at ntischool.com. We hope to see you soon.